Hi, my name is Kristin. I'm a physical therapy student at NYIT. Today I will be demonstrating manual muscle testing for hip internal and external rotation in the gravity minimized and against gravity positions. For gravity minimized, you want to have your patient lying supine on the table, legs down. Okay, so I'm going to ask Melissa to bring her leg up, and you want to have a 90-degree angle between by the knee joint. For the first test, I'm going to start internal rotation, so you start the patient in partial external rotation. And for a grade of trace, you want them to try to bring their leg out towards you. Now, a grade of trace, the patient will not be able to do that. There will be no movement, but there will be a general palpation along the gluteus medius muscle. For a grade of trace plus, the patient will now be able to bring their leg halfway through the range of motion out like this. And I want to look for compensations, which could possibly be them adducting their leg this way and bringing that hip off the table. So you want to make sure you stabilize them with the feet by the femur so they don't do that. So again, now we'll do grade of 2 or poor. Poor will be that they can go through full range of motion against gravity minimized, no resistance. Go ahead. Is that all you can go? Mm-hmm. Good, that's all she can go. Now I'm going to have her do that again for a grade of 2 plus or poor plus. This time she'll be able to go through the full range of motion against minimum resistance, which I will apply just proximal to the ankle joint. Ready? Go ahead. Bring it all the way through. Good. Is that all you can go? No pain? Apply my end pressure, end feel, overpressure, and bring it back to neutral. For external rotation, you start them in partial internal rotation. Again, the general palpation is going to be in this area. You're not going to feel the gluteus medius. There's different muscles working, but they're generally underneath. So you don't want to make your patient uncomfortable. So you just want to palpate this general area for contraction. Again, there's going to be no movement for trace. For a trace plus, there will be movement through partial range of motion, less than half. Bring it back. She's going to go for a grade of 2 or poor. You're going to be able to go through full range of motion. Is that all you can go? Mm-hmm. Apply my overpressure, and a compensation for this one will be abduction of the leg. So you want to make sure that they're still stabilized at the femur. Bring it back out. For a grade of 2 plus, she's going to be able to go against my resistance, full range of motion. So can you fight my resistance? Good, 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 good. Apply my overpressure, and that's it for the internal external gravity minimized. Now for against gravity, you have your patient sitting up. So please sit, Melissa. You want to place a towel roll under the leg that you're going to be testing because you want the femur to stay in a horizontal direction. Again, you can stabilize your femur on top, and what you're going to have them do, so if you do internal rotation, you start them in partial external rotation. So I'm going to ask her to bring her foot out towards my hands this way. Can you do that for me? Is that all you can go? Mm-hmm. Good. Now, you would do 3. So a grade of 3 would be full range of motion, no resistance. For a grade of 3 plus, it would be full range of motion, minimal resistance. Go. Good, good, good. Watch for compensations that they're not lifting their hip, tilting their pelvis or trunk. So you want to make sure that they're stabilized again. Grade of 4 is moderate resistance. Go against me as hard as you can. Fight, 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 fight. Good. Overpressure at the end. Bring it back. Now I would test the contralateral leg to see what the difference in strength would be. So a grade of 5 would be that they went through the full range of motion against maximal resistance. Grade of 4 would be against moderate resistance, can't fight me. So now, for external rotation, you start them in partial internal rotation again, and she's going to bring her foot towards my hand. Good. Try to tuck this leg back so they can go through the full range. Good. Okay. So that was a grade of 3. She went through full range of motion. Grade of 3 plus will be against my resistance, just proximal to the ankle. Go ahead. Minimal resistance, overpressure. Good. Grade of 4 would be, again, fight me as hard as you can against my resistance. Go ahead. Good, good, good. Overpressure. Compensation, again, would be pelvic tilt for this position as well. So now grade of 5, you would test 4 and 5, you would test the contralateral leg again to see if there is a difference. 5 would be maximal motion through that and strength through that leg. 4 would be a little bit less. And that's it for hip internal external rotation in the gravity minimized and against gravity positions.